According to the World Health Organization, coronary heart disease deaths in Kenya account for 4.54% of total deaths, including heart attacks and cardiac arrests. While many Kenyans confuse a cardiac arrest for a heart attack and vice versa, Dr. Mufadal Shokat explains to us that the two are different.
So for the heartbeat to be produced, there is an electrical activity that goes through the heart. It starts in the sinoatrial node and then it spreads along the heart muscles. And then when that electrical activity is complete, the heart muscle pumps and a beat is produced and the blood flows through our heart. So when you get a sudden cardiac arrest, there is a problem, there is an abnormality in the electrical activity of the heart. So basically in a heart attack, your blood vessel is getting blocked. So basically you have high levels of cholesterol and they are slowly causing a blockage in your heart.
He tells us that for a heart attack, one would see symptoms such as chest pains, breathing difficulties, body pain, among others.
Someone who is diabetic, someone who's not exercising, someone who is obese, and then they come and tell you they're getting chest pains, okay? This is a classical sign. It radiates to the left side of your shoulder, to the left side of your hand.
And even though a heart attack is preventable, many Kenyans still lose their lives to it. Dr. Shokat says that with a quick response, it is possible to save the life of a person suffering from a heart attack.
Most likely, we will not lose a patient, we will not see them pass away, but maybe it can leave them with a disability, maybe a poor quality of life, because now it leaves you with a heart that is not functioning well.
On the other hand, a cardiac arrest comes as a sudden loss of heart function, breathing, and consciousness. In case one is having a cardiac arrest, you could see them suddenly collapse, have no pulse, not breathing, among other symptoms.
So if you try and take a pulse, there'll be no pulse and they will not be having, you will not see them breathing. You can just find that someone has been very well, but then they'll just say, I have a little bit of a chest discomfort, or I can feel my heart is beating fast, we call that palpitations, or they feel I'm feeling a little bit lightheaded, you know, and then suddenly you just see them collapse.
Dr. Shokat recommends performing a CPR with hard and fast chest compressions on the patient or immediately call for emergency services.
CPR is basically cardiopulmonary resuscitation, whereby you are going to compress the chest wall, okay? And if that is a trained person, you do it 30 times and you have to give 2 breaths. What we call a mouth-to-mouth breath. Yeah? This is not done. If a CPR and a defibrillator is not been given on right time, then we can get a sudden cardiac death.
Certain lifestyles, such as smoking, contribute largely to cardiac arrests and heart attacks, as well as underlying conditions such as diabetes and high blood pressure.
And then also when you have a heart condition that has possibly not been known, maybe you have a problem in your heart valve, maybe you have an enlarged heart, you want to avoid habits that are toxic to your heart, which includes smoking, which includes alcohol use, okay? And you want to take care of your diet, avoid foods that are high in cholesterol. You want to keep exercising regularly, so that this gives a good health to your heart, and this prevents you from getting such events.
Robbie Omondi, K24 Health Beat.